So my name is Jenny Kelly. I'm the new Director of Communications and Program Advocacy for Hartford Community Action Agency. And I'm just going to give you a little overview to start of an overview of our programs. I'm going to be introducing some of our other directors in a little bit so they can give a little more in-depth information. But obviously we do a little more than housing. We do food pantry and energy assistance and various other new programs that you might not be available or might not know that we have yet. So what's our mission? Our mission is to help anyone in Hartford County who's experiencing financial hardship. And the main ways we do that is housing, food, and energy assistance. And then we also have other programs to help with family budgeting and counseling, and we have some new programs like food advocacy that we'll be talking about. We basically want these individuals to become self-sufficient, and we hope that we can get them there. So how are we different? There's community action agencies all across the U.S., and we are just one of them. But we differ from some other organizations in that we don't just work ourselves. We work by all of our other partnerships we have. And that would be like the Epicenter, Tabitha's House, Welcome One, Hartford Family House. We work with all of these different agencies and organizations so that we can help our clients get that self-sufficiency that we're looking for. So this is kind of a list of all of our different programs. We have energy assistance, case management, supportive services, of course the community food bank and pantry. We have a new compliance department and then the new communications department. So we're gonna have Brittany Ayers up next. She's our director of case management, and she's gonna talk to you about that as well as energy assistance.
Hi. I'm a little nervous, but it'll go away soon. My name is Britt Ayers, and I run a new program that we have. I'm the director of our community case management, and really the thought behind that is trying to be an all-encompassing agency that refers to outside agencies. Like community action is a starting point for a lot of different things, as you saw on the last slide. But it's actually connecting the people to those resources that I feel like is a missing link in Hartford County. And so that is something that we are really, truly trying to work on. But Rome wasn't built in a day, so you gotta, bear with us. The first thing that I'm gonna talk about is the Maryland Energy Assistance Program. I do not run this program. This is run by one of the other directors that could not be here, so I'm just gonna kind of read through the slides. I can't answer too many questions about energy assistance, but out on the table, Lisa's cards are out there if you have any direct questions that you need to ask her. So Maryland Energy Assistance, also known as MEAP, provides assistance to Maryland's low-income households to help our clients stay warm, connected, and help pay past due energy bills. They provide assistance with winter fuel bills one time during the heating season. The income eligibility for MEAP is 175% of the federal poverty level. Clients who applied for MEAP during the last program year will automatically receive an application in the mail. Oh no. Okay. The Electric Universal Service Program provides a grant applied monthly to the client's electric bill. This special credit helps to make the utility bill more affordable for low-income families. The EUSP also includes an arrearage component which can be used once every 7 years to clear up past bills between $300 and $2,000. There are certain requirements that must be met to participate in this program. I keep hitting the wrong one, I'm sorry. Okay, so like I said, I don't work specifically with MEAP, so you would have to call that director directly to ask her any questions that you may have. Now on to my wheelhouse. All right, community case management is something that we started doing this summer back in July. We noticed the issue, like I stated earlier, was that it's very hard to actually connect clients to the resources that we need. And going to meetings, we find that there are actually a lot of different things that can help our people out there that we are not aware of. I mean, a lot of people don't know about Hartford Community Action Agency, and we've been around for 30 years. And we're also the centralized intake for all of the homeless services in this county. So it's always surprising to me when people are not aware of us. So community case management houses a few different grants. The way that we do case management in-house is everybody that comes into our doors is given a referral form with a list of resources that they are interested in. The referral forms are out on that table, and you guys may have grabbed one. There's a varying topics on it that housing, homeless services, food, mental health, a bunch of different things that clients may be interested in. They just don't know where to start. And sometimes we don't have the answers either, but it helps if there's somebody, sitting right next to you figuring it out with you. We do try to establish goals with clients that fill these referrals out and help them try to meet them. So Parenting Inside Out, I hit the wrong one again. Parenting Inside Out is one of our new initiatives that I started running with my coworker Jose back in July. It's a twofold program. The first part is that we go into the detention center, and the second part is that we teach in the community. This program is an evidence-based cognitive behavioral parent management skills training program. What it does is it is a 6-week and a 12-week program. The 6-week is inside the detention center. And what we do is we work with the inmates to try and help them develop parenting skills that they may be lacking because of the decisions that they continue to make. It has been received extremely well. We cover a variety of topics. We talk about empathy, we talk about positive discipline, we talk about how to communicate with your child's mother or father or grandparent, basically their caregiver. And we have just completed our 3rd session. The first 2 sessions we did with males, the 3rd session we just completed with the females, and they absolutely love it. This training comes out of Oregon. It's been going on for about 10 years. Mostly it's used in actual prisons, but we, do it at the detention center because that's what we have in Harford County. Along with that is the case management piece. So we do try to encourage the we call them students, when they get out of the detention center to come meet with us at the agency so that we can continue to help them with things that they need, because it's reentry and recidivism is a big passion of mine, and I think that it starts while they're in the detention center rather than when they get out of the detention center and they have nowhere to go and no one wants to help them. So this has been received very well. I'm actually going to start going into the detention center on Mondays to sit with them to see what the need is so that we're talking about it before they get out. And that's not just the students in my class, but also just any inmate that's getting ready to be released. The community program is supposed to be 12 weeks. We've condensed it to 6. We're doing a 4-hour class 1 day a week at the Edgewood Library. 12 weeks is a bit much for clients who don't have transportation. So we are trying to, have one stable location where we meet once a week. We do provide food. We do provide incentives like gift cards if they continue to come. And it's just a safe space and a support group for the parents who either, if it's the grandmother who's raising the kids while her daughter or son is locked up, or if it's a couple, where someone was just released and they're just trying to figure this parenting thing out together. It's a really great program for them to go through. So the second grant that I run is called Reducing Childhood Hunger, and this is run by my coordinator, Courtney Trey Montana, and she has done an amazing job of creating a 6-week course that covers a variety of topics. They talk about budgeting, they talk about eating healthier. Now, we're not dietitians, so that's not our main goal, but we do go based off of the My Plate that Michelle Obama started, which is like now the new food pyramid. And she cooks with them, she teaches them how to wash their vegetables, how to cut them properly, tries to introduce them to foods that they may not eat regularly. And this is all one of Governor Hogan's initiatives with reducing childhood hunger. So is the Parenting Inside Out for incarcerated parents. Courtney also goes into our lobby and she does Try It Fridays, where she comes up with a different snack or a different food. The first time she did it, it was like a variety of tomatoes, which the kids really loved, which I said that they were not going to love, but they did. And she just encourages them to try something different, because we have crop shares at our food bank, and sometimes parents don't take the food because they don't know what it is. They don't know what a squash is. They don't know what oregano is. And Courtney's initiative is to try to get them to not be afraid to try it. So that is a 6-week course, and that runs consecutively. So she does 6 weeks, it'll end, she'll pick it up on another 6 weeks. It's held on Wednesdays from 1:30 to 3:30 at our main building at 1321 Woodbridge, and that is in our break room. Another part of Reducing Childhood Hunger are grocery store tours. So we have a partnership with ShopRite, and Jane Klein, who is a registered dietitian, leads the store tour, and she takes them through, and I believe it's about 30 to 45 minutes, and they just cover the same topics that Courtney's been trying to emphasize on for the past couple of weeks. They also receive a gift card to ShopRite afterwards to help supplement grocery bills. Another item that is under community case management is employment assistance. So we have somebody in our office that will meet with a client, and they will take the time to cover a variety of topics, well, the resume being number one, but how to interview for a job, because a lot of people, especially clients that we deal with, do not know how to properly interview. How to dress for the job. She sits with them and she actually goes step by step and helps them to apply for jobs online. It takes about 2 hours, and it's been received really well, and I think it's important that this is out in the community because a lot of people don't know, and they're not getting jobs, and even if it's not a very well-paying job, it's better than nothing. So that is something that we are doing. That's also at the main office. One more thing, and this is actually going to be a little bit farther in your slides, conflict resolution. This is something that started back in July too. This is a new initiative. This is run by Maddie Cochran, and part of her job is to go into alt ed in Aberdeen and work with the students in there on anger management, listening skills, whatever else they may be lacking. But she's also a key to community services who runs mediation, and so she's a good referral source, and she's also a mediator herself. So that slide is somewhere in there. We just kind of got it jumbled around. And the last thing that we have that I'm going to talk about are the partnerships with HCAA. We have a few. We have a really great partnership with Healthy Hartford. We're actually going to start working on getting their HealthLink bus to come up to Community Action maybe once a month and do the simple blood pressure tests and things like that. We work with Hartford Community College, and they have pre-GED and adult basic education classes at our supportive services location, which is at 1010 Gateway. And they offer free advising there too, about every 6 months. And then our last partnership that's really important is with Seedco, and they provide healthcare navigators on site for us. And actually, I'm going to hand it over to Lana, who's going to talk about what they do. And that's it for me. No questions. No, I'm just kidding.
Afternoon, everyone. As Britt said, I am actually a Seedco navigator. I have seen a couple friendly faces in the area before, but what we actually are is a national nonprofit agency. We work within 10 counties in the state of Maryland, and locally we work within Cecil and Hartford counties. As most of you are probably aware, that the Patient Protection and Affordable Care Act was passed in March 23rd, 2010. The Maryland Health Connection opened for, I guess, enrollment for 2014 in the fall of 2013. Seedco has been there since the beginning. We received the grant from the Maryland Health Connection to become the connector entity, the navigator contract. So we've been providing in-person assistance since then. So what does that actually mean? Essentially, navigators provide free one-on-one in-person assistance. This includes outreach, education, and enrollment in both qualified health plans and in your public insurance plans. Typically what we try to do, we do take different walk-ins from clients, people take referrals, but we try to set up appointments to kind of help them make the best decision when it comes to their health care. For their insurance. We often are experts in this area because by the time people find out about us, they have jumped through every hoop and talked to so many other people in the area before they actually get to us. We're thrilled when someone makes a referral to us in the beginning, so that way we can make this a really good experience from the get-go. I myself have actually been doing this for 4 years. We just completed our 5th open enrollment, as everybody knows, back here in December. And so we are actually a resource, a completely free resource in your community all year long. We maintain offices in Churchville on 22, right down from the college. And we also have our main office in Elkton near the Big Elk Mall. Now, through our partnerships, you may find your navigators at Union Hospital, at Beacon and West Cecil federally funded health centers, at the Department of Social Services. We often are found at the Harford County Public Libraries, and of course, you can find us at HCAA. We are always willing to participate in public events to continue the education of the public about their health insurance options and about the free resource that is available to them in their community. So one of the things I'll tell you is that because I've done this for a long time, we've helped all kinds of different clients. We help those people who are transitioning out of certain circumstances, whether it be come out of the detention center, whether it be through trafficking. We help individuals who are transferring from medical assistance into the Affordable Care Act plan. I help people who are restaurant owners, who are crabbers, who are farmers. We help people who are making six-figure salaries. We pretty much help anybody in the county that could potentially use our services. And so what I want to tell you is that I've been doing this for a long time, and a lot of people have heard about the Maryland Health Connection who have had problems either navigating through it or doing that. That's what we do, and we do it great happily. We want to make sure that everybody has the right information so that they can make the right decision for themselves. So again, you can find us all throughout your community. We'll have some information here. I'm going to be here obviously till the end. If you have any questions or would like to connect with us, like I said, we're happy to come out to also do different presentations, whether it be with your staff, whether it be events that you're working at. We've worked at plenty of the Healthy Harford events. We also work at the college, a number of other places. But our main intent is really to let people know you have a free resource for the Maryland Health Connection that's in your community to help your clients and or even get the bills paid for the services that they need. That's going to be the end of it for me, if anybody has questions. Otherwise, I'm going to turn it over to Brian Wainwright.
Thank you, Lon. Appreciate it. Make sure that I have this correct. Supportive services. And I think it's important to note that we should, Lana, didn't you have a slide? Did you take that out?
It was the same one that just didn't hand out.
Okay, I just wanted to make sure that she didn't have a slide, just in case if everyone in attendance wanted to review that. So, good afternoon, everyone. My name is Brian Wainwright. I'm the Director of Supportive Services. The Supportive Services office is located at 1010 Gateway Road, as Lana previously mentioned. She is at our office, so you can commonly find Lana at our particular location. On Tuesdays, just to kind of reiterate, there is a gentleman by the name of Ivan who is there for bilingual services, just in case if that's a need for your clients. But fast forward into homeless prevention services. This is a very popular topic for everyone here in the county. We get a lot of phone calls, we get a lot of walk-in inquiries, requesting information in regards to these services that we provide. We commonly provide assistance to families that have children, but primarily that is our main objective. But there are additional funding sources available for households that may only have adults in the home. But like I said, primarily we cater to those households with children. The income eligibility for these services is 200% of the poverty line. That is a little different from the food pantry and some of the other services that Harford Community Action Agency provides. But we'll get to that a little later. We can only assist, and we really wish that we could help a little bit more than we commonly can, but $500 will go to the households who are in need and or are facing an eviction here in this county. In order to get an appointment at our offices, you do have to have an eviction notice in hand. What we commonly tell everyone throughout the month that we have a walk-in date at the end of the month to provide assistance to these households. But in the event any household experiencing an eviction notice to where it's kind of expedited to the process of a set-out notice, obviously some landlords will give their tenants 24 hours to vacate the property. Some we've seen 3 to 5 days. I've seen it even a week and a half. But if you have clients who do receive a set-out notice, it's imperative that you tell them to get down to our 1010 Gateway Road offices so we can expedite the process and hopefully, convene to the point to where they're not going to be displaced. And obviously, there's income eligibility requirements. There is, if this household received eviction prevention services in the past, if they've received energy assistance in the past, that may or may not deem them ineligible. We say may and may not because if a household receives energy assistance and it's pulled from the same funding source that we commonly provide assistance to households with an eviction, unfortunately we will not be able to assist them. So it's within that 2-year parameter that they have to adhere to to those guidelines. Another important, and let me go back, I'm sorry. Speaking to the walk-in date, January 31st, 1010 Gateway Road will host our walk-in date for January. We tell everyone to get there early. Our office is open from Monday through Friday, 8:30 to 5 p.m. However, with this type of resource and this type of need, there will be a line, and I've seen lines forming anywhere from an hour and a half prior to our beginning start time at Supportive Services location. So I wanted to touch on that. Another big aspect of the Supportive Services location is that since August 2014, we were awarded by the county that we are the centralized intake location for anyone who's experiencing homelessness here in the county. So we will screen an individual, a household to come into our location, and we will place them on any and all wait lists that they qualify for. Some of our community partners that we refer out to is the Welcome One. I'm pretty sure that you're familiar with that. I think they're in attendance today. Anna's House, which is an emergency shelter and transitional housing. Same thing with Hartford Family House, which is also emergency shelter and transitional housing. We also refer out to permanent supportive housing options with United Way. Hartford Family House has 6 units under their roof that can assist in that regard. And here recently, some of our community partners and subcommittees have been coming together to try to raise awareness to generate more funds for permanent supportive housing, because what we've seen here in the county, specifically with the homeless population, there's a high prevalence of these individuals in households to also have mental health diagnosis. So permanent supportive housing obviously will be a resource that will graciously, assist households that are seeking housing assistance. Let's see. Currently, 1010 Gateway Road is very, very busy because I don't know if you guys are aware of this, but the emergency rotating shelter starts from the middle of December all the way to the first week of March, and we are facilitating people in and out of that resource. And those are people who are literally living on the streets, living in their car, or a place not meant for habitation. So that's the priority population, if you will, from a homeless services standpoint. We really are trying to capture those households that unfortunately fall under those circumstances. Transitioning back to the 1321 Wood Station location, which is the main office of Hartford Community Action Agency. One of the big resources that you're probably already familiar with is the food bank and food pantry that we have at this particular location. As you can see, we've been doing this for over 30 years. And Hartford Community Action Agency actually supports over 90 partners here within the county to help feed households, schools, and families within our community. It's a wonderful resource. This particular resource falls under the 300% of the poverty line. That's the income eligibility requirement. And families can come to this particular resource and once every 30 days, and hopefully they can get groceries that will help supplement them to their next meal. And obviously, when clients come into our location, we try to help them, link them up to other food resources in the county, obviously, given the fact that once every 30 days may be a big barrier for that particular household. So we try to link them up to additional resources to kind of help them in their situation. Which leads to the next slide, which is compliance and grant writing. Our Our Director of Compliance is Natalie Shaw. With all the services and the programs that we kind of briefly touched over today, obviously there's a lot of things that we have to keep in line and make sure that we're meeting all of our reporting guidelines and our requirements with the federal, level, the state level, and the county level as well. So there's a lot going on under both of our roofs. So Ms. Shaw is consistently busy, always trying to make sure that we're looking good and the data is captured and we're moving in a good direction, because hopefully we can expand to more services here in the county. And that will lead me back to Miss Jennifer Kelly. Thank you for having me.
All right, so we do a lot, right? Yeah, a lot of different buckets. So as I said, I'm the new Communications and Resource Advocacy Director, and so I was basically hired because we have so many different services, and we need to get the word out, as Britt said earlier, that a lot of people don't know who we are and what kind of services we offer. So it's now become my job to help spread that word and educate all of you and educate the public on what we do. So the first program I run is a new program called Resource Advocacy. We are working in partnership with Harford County Public Libraries and the United Way. And basically the point of this initiative is to connect the dots between residents and all the different resources that we offer or we have connections with. So 2 days a week, I'm actually in Harford County Public Libraries. On Monday, I'm in Aberdeen all day. And on Tuesdays, I rotate Bel Air, Edgewood, and Havre de Grace. And I basically sit near the front door. I have our banner and all of our stuff up to call attention to that we're there. We've created bookmarks to let potential clients know what dates and times that we are going to be there. And they basically come up to me. At first, it was just because like they would see us and be like, "Hey," and I'd be like, "Can I help you?" But now, since we've been there since the beginning of November, they're actually starting to learn that we are there, and they are now actually coming seeking us out. So I meet with them and I help them fill out the what's it called? Referral form that Britt talked about, and I send it directly over to her, and then that way it's a faster link to then get them hooked up to a case manager to help them with whatever needs that they're looking for. So that's a new program that just started and so far is going very, very well. So you probably heard Brian talk a lot about how we're mainly funded by grants. Another initiative that we're having is a lot of times grants pay for XYZ, but what happens when that grant money runs out? So we're going to start having some more annual events and fundraising so that we can have that in a fund that we can pull from when said grant money may have run out. So some of the events we're having now is Share the Love campaign. That's actually going to be next month. Check us out on Facebook. It's just facebook.com/Harford Community Action Agency. And we're going to be creating a whole campaign asking people to maybe take a selfie and showing us how they're, hashtag sharing the love. And then we're going to try to raise money for all the different various programs that we do that, like I said, maybe the grant money won't cover. We also have a bull and oyster roast, which is going to be on Friday, April 27th this year. And that will be at the Bel Air Armory. So start looking for information about that. I think there is a link to that on the homepage of our website right now. Every November, we have an event called Pack to Give Back, where we have volunteers from all of Cobb County. Some of you may have been there this year, where we pack all kinds of bags, holiday bags, each filled with enough food to feed a family of 4. So that's always like the Thursday before Thanksgiving. Bagging Hunger is another program we have with local Safeway stores where people can donate a already pre-filled box that it comes directly to us, and then we can directly give it out to our food pantry clients. Some other ways that we fundraise is through an annual appeal. That letter is actually going out the end of this week. In the past, we've kind of targeted people that have given to us in the past. This year, we're going to maybe start going after some other larger community members, business owners, because we feel like the need for homeless services and food and education is the entire Harford County's responsibility to help, and we're hoping that maybe they can help us with some of our other costs. Checkout Hunger campaign is something we do with Wegmans every year, where people can give directly at checkout. And then we always have ongoing website donations available right on our website. Okay, so besides all of that, I also have to make sure that we maintain national branding standards, which anyone else that's in marketing communications, you probably hear people talk about all the time. You need to stay on brand. That's important so that people know who we are, what we do, and why we do it. I'm also responsible for our annual communications plan, developing marketing assets. So this is where I would come to you. My card's out there. If there's things that you need that you think would help your clients to see the different services we offer, or if there's other events you would like to be held, I would be the person you could contact so that we can work on that. I manage our website and social media presence. I don't know if anyone of you like our Facebook page, but if you probably noticed in the last 2 months, we should now be seeing a daily presence of us on the website. So that would be another thing. If any of your agencies or employment centers, if you have a big event that you think would be applicable to our clients, please send that my way, and I'd be happy to share it on behalf of both of us. And then this is just a quick overview to show you how we've helped. You can read that all yourself, but we've served over 15,000 people in the last fiscal year, 629,000 pounds of food, over 730 families through security deposits and helping people not be evicted, and then utility assistance for over 12,000 local households. And we can't do all of that without everyone's support. So this you'll start seeing next month in our Share the Love campaign, where we're going to start asking people that even $1 donated will equate to 10 meals to help someone in our county. So every dollar counts. So that's it for me. I'll turn it over to questions and answers if you have any questions for Brittany or Brian or myself. No? And then Kim and Lisa's cards are out front if you need direct questions for energy or food. Yep. Thank you.
I have a question. Brittany was talking about the employment assistance. Is there an age limit to that?
So the question was if there is an age limit to the employment assistance program, so
No.
there isn't, okay.
We can help, as long as, if it's a 15 or 16-year-old, we would prefer that a parent comes along just to keep things appropriate, but no, we'll help anybody.
So basically, anybody can participate in that program, but if they are a younger minor, they would like a parent to be there to participate to make sure that everybody's on board with the plan. Any other questions? Yes, here.
Is Seedco only for the HCAA, or can they help with Medicare too?
It's not the Medicare.
So the question was, can Seedco help with Medicare? And the answer was yes, Seedco can help with Medicare.
Medicare, Social Security, so that isn't something that we do. We do generally do Medicaid,
Right.
so that is what we do help with.
Medicare would be us.
Yeah, and actually, we actually have a tendency to refer back to what
Yeah.
we have a number of consumers who are reaching the age of 65 who are now going into Medicare and trying to point them into the Office of Aging, which is kind of a similar resource for that portion of it as we do.
Yes, so they work with the Social Security Medicaid piece, and Medicare Services kind of supports questions and answers would be through the Harford County Office on Aging State Health Insurance Program, which is in your binder in a previous session. So actually, I think in 2 previous sessions. Any other questions? Anything in Harford Memorial question-wise? Anyone else here? Okay, well, thank you so much, Harford Community Action Agency, for the good information. Can we give them a thank you? And also, they have a lot of materials they brought with them that are out in the hallway, so make sure that you pick up all of the materials so that you have everything that you need at your fingertips. They had some applications that they also had in Spanish language. What were those for? Energy assistance. Okay, so they're back there, also available in Spanish if you'd like them. So I'm trying to talk and be tech at the same time. I did. I'm so impressed with myself.